Some people are reporting unusual symptoms associated with the Omicron variant. Doctors warn these symptoms could be mixed with common conditions connected to the flu or cold and should not be ignored. CBS 8's Abby Alford shares the unique symptoms that Omicron patients are seeing.
Doctors and hospitals and urgent care say that more patients are coming in reporting newer symptoms associated with Omicron, including night sweats.
Weird, vivid dreams, pink or bloodshot eyes.
Night sweats. I got night sweats, which I did not know was a symptom of COVID.
Doctors say night sweats was not a common symptom with previous COVID variant cases, but it is now with Omicron.
Well, since the beginning of this pandemic with COVID-19, it's always been sort of a bucket of crazy symptoms.
Escondido father Jason Borgmann says the sweats lasted 4 nights. Last night was the first without symptoms.
Waking up at the middle of the night, just soaking. My giant forehead was covered in sweat. My pillow looked like glass had been spilled.
At first, Jason didn't think it was COVID. He's vaccinated, masks, and really doesn't leave the house, but he took a PCR test and tested positive.
And it was more likely allergies, and then maybe a cold. It's that time of the year.
UCSD Chief of Medical Infectious Diseases and Global Health, Dr. Davey Smith, says these symptoms should not be ignored, even if you think it's the common cold.
So we've known the most common in terms of cough, headache, fatigue, fever, and those are still the case in Omicron. But there's other things like losing taste and smell, scratchy throat, just feeling a little run down.
We asked on social media, what are some of the unusual symptoms that you didn't expect? Night sweats is common. Alyssa says a long haul effect from the Delta variant is that onions, meat, and coffee taste like sewage, and anything minty tastes like chemicals. Kirsten comments that her nose burns as if she's breathing in negative 40-degree air, and she has a headache.
Don't assume you have a cold. Don't assume your allergies. Don't assume anything else. Assume COVID, and act accordingly.
Remember, Omicron symptoms can be mistaken for the common cold or flu. Doctors say to stop the spread, you do need to isolate.